Let's talk about functional medicine, Chuck.
Yes, it's been a while. So let's talk about functional medicine.
Have you ever heard of it?
Uh, I am more on the functional working out side of things, functional exercises for like core and
Okay, got
avoiding
it.
sprains and aging now that I'm aging, but not necessarily functional medicine.
Yeah, yeah,
So yeah, that's kind of a cool concept.
yeah. It is. It's really gaining a lot of traction as I've learned about it. As you know, I've transitioned from being in called traditional medicine, where I was a general surgeon, and very interesting. A lot of stories that can be told
I
about general
bet.
surgery.
I bet. That's a whole new
Yeah,
podcast right
whole
there.
nother podcast. Yes, but I really became dissatisfied, and it was a whole long story how I moved from traditional medicine, being a general surgeon, into functional medicine. And let me define that first.
Yeah.
Functional medicine, it's kind of hard to define. It's kind of a term that has taken root, but I guess the best way to identify it using the term is that we are recognizing that, I like to say, every effect has a cause. And that may sound trite until you recognize that for instance, in my training, I remember distinctly in medical school, we were told 95% of people have essential hypertension. So I said, why do they have high blood pressure? We don't know. That's why it's called essential. They just have it. I'm like, okay. I wasn't getting any answers, but it just is. And so, lady comes to the office with diabetes. Why do I have diabetes? I don't know. Ate too much. We don't know, but we can treat this. You've got diabetes. We can treat it.
We can throw something at it.
Well, absolutely. And we're really good at that. We're really good at that.
Let's see if this works.
Right. But importantly, every effect has a cause. So we know this in our daily lives. Things don't happen just out of the blue.
Right.
And you can always find a reason. So why am I sick? Why do I have diabetes? Why do I have that high blood pressure? Why don't I feel well? There's a reason for it. And functional medicine says you work as a whole, your body, you as a person, all your influences from growing up, how you were delivered has an impact on your health. Did you know that, for instance, vaginal delivery is actually in many ways more healthy than a C-section? And you can have increased risk of obesity from having had a C-section.
Wow.
Yeah. So these things can go all the way back. And the idea is in functional medicine is to get at the root cause. Why do you have this? How is it impacting your whole body? What are the antecedent things that led up to this condition? And we need to take a deeper dive into all those possibilities to bring you to your best health. So we want to establish healthy function instead of just treating a symptom. Let me ask you this to kind of drive the point home. You've got a wet spot on your carpet. You wake up in the morning and there's a wet spot on your carpet. And you think, I don't want a wet spot. So you dry it. And you say, great, everything's all taken care of. The wet spot's gone on my carpet. And until the next rainstorm comes. So,
See, I was thinking of putting the dog outside overnight.
yeah, I know. I was worried about the wet carpet part, but but see, you've looked at the different causes of it. So you immediately went and said, okay, I'm going to put the dog out, but you'd still want to dry the carpet.
Right.
And so you're taking care of the problem. Well, suppose you had a leak in your roof. You could put a bucket over the spot and capture the water, and now you've solved the problem. You're not going to have the wet spot on your floor, but
Still have to leak.
you have a leaky roof, and the leak could continue to worsen so that the water overflows the bucket and so on and so forth. So by putting the bucket to capture the water, you're just treating the problem. Whereas functional medicine would say, let's go take care of the roof. How did that happen? Tree fell on it, hailstorm, old roof. Let's find out what it is and go about taking care of it.
Wow, that's much different.
It is much different. And I think, importantly, I think people are waking up to this. I think people are dissatisfied. And I think we're seeing what I like to call a paradigm shift in people's thinking. I think over the years and decades that I've been in practice, I see people more and more wanting better answers. They want to take control of their health, and they're increasingly dissatisfied with the answers that they're getting. And so they're looking for something else. And that paradigm shift is, I think that's why you're hearing so much more about functional medicine, because people are gravitating towards it and they're saying, finally, this is giving me answers. I understand this. I get it.
I think that's a big piece.
Yeah.
That they understand it. They kind of get it.
Right.
As opposed to, oh, this is what it is. Take this and no explanation.
Right. Right. And the interesting thing is that many, 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 many of the answers are all there in the medical literature. They've either been overlooked or discarded. They didn't fit the paradigm, for instance. And so so many times I've come across things and I think, why wasn't I taught this? It's 30 years old. Why wasn't I taught this? And people are waking up to that and they're saying, I want something different. I don't trust all these chemicals. I got all this stuff in my environment. How can I be healthy? How can I take care of myself and my family?
So with that paradigm shift and people feeling attracted to it, our insurance is paying for it.
I think that's changing slowly. You have wellness visits. You have you have wellness visits, and people are trying to take a more proactive approach. But still, we're very much locked in the model of, I need a billable code, I need a diagnosis code or a billable procedure, and that's what the insurance company is going to pay for. So the reimbursements, what is out there, is not keeping up really with the needs, because as I said, for instance, a functional medicine doctor is going to sit down and take a deep dive into your history. Going back, like we said, how were you born? Were you breastfed? That takes time, and you can't charge for that time in our current system. So no, the insurance company, I think, is not keeping up with the people's needs.
Yeah. Okay. Because that would be certainly in my line of work as a therapist. That's not going to happen.
Right.
Preventative mental health. Really, people. That's just not going to happen. And further along that line is the fact that insurances will pay for mental health, but the level that one has to get through before they fit that diagnosis, you really have to be struggling, as opposed to, I call it early is easier, where you can catch these symptoms of depression, anxiety, way upstream, and get assistance, get support, and you just go back to functioning, to your points,
Right.
A little better.
Right.
And there are models out there. Australia has a really amazing program that is for folks that are in that category, that they don't fit a diagnosis, but they still need help. They still need assistance. And it looks phenomenal. I haven't interviewed therapists and programs there, but I see their workbooks, I see their programs. I'm like, man, that is like so on target.
Right. I can't help but think that would be effective.
Yeah.
For the same things that we're talking about in the physical correlate. You have, for instance, prediabetes, and it's best to think about, just like you were saying, about these things on a spectrum. So prediabetes is just early diabetes. It just hasn't gone on long enough to become diabetes, which now the insurance company recognizes, and the doctors say, oh, okay, we have a diagnosis, so we're going to treat the diagnosis. But in fact, that started 20, 30 years earlier. Wow. And the damage, just as you have seen, I'm sure, in your practice,
Yep.
the damage has been going on and on and on. It just didn't rise to the level of attention that
So-
it should have.
For folks who literally buy into functional medicine, how confident are they that this is going to work? This is going to work at least as good as traditional medicine. I trust it. And it's, I believe there's efficacy here. And I'm confident. I believe it. I trust it. Are we there yet?
It depends on the individual. There are some people that I'm going to my doctor, I'm going to listen to what my doctor says, and I'm going to do this. And I believe these medications and these treatments are the way to go. Other people say, I'm not so sure. I've tried that and it hasn't worked. So I'm willing to try something else. And then when you can explain to them how the various pieces fit together, the light bulb often goes off and they say, okay. And then on top of that, and it depends on the individual again, but people are recognizing that they can take control. They can
Right,
be their
yeah.
own health advocate and be doing the things that, and it's a lot of functional medicine treatment is education as a result.
So do you think, I think there's a myth because the medical model has been around so far for so long that it's accepted that this is a trusted avenue for healthcare.
Right.
Like people just, this is what we do.
Right.
But there's a lot of people that, excuse me, there's a lot of people that don't trust the medical community. So when you're looking at a functional medicine model, do they have clear outcomes? How would you measure wellness now, after they go through their regimen of treatment, whatever that might be, to say, yes, this was successful? How does that work in functional medicine? In the medical model, it's symptoms, no symptoms,
Right.
pain, no pain,
Right.
sore throat, no sore throat.
Right.
Okay.
Right.
And then you got to get the bucket to get it the next time it happens, right?
Right.
Okay, well, we'll bring the bucket in this time, and okay, the third time maybe we put it higher so it doesn't drip all the way to the car. I mean, it just
Right.
okay.
Yeah.
So how would we get those outcomes in functional medicine?
Great question. Well, some of it depends on what you're dealing with. So the sore throat, you come in, you've got pain, you need your sore throat taken care of. One way to do that is, say, with antibiotics, and the sore throat goes away, and you have a marker, that pain, okay? And the use of antibiotics and sore throats and whatnot is a whole nother topic, but we could go into that at another time. But so there's acute things, and there's pain, and there's identifiable problems. So if you can get rid of the identifiable problem, you could consider that a success, but it depends how you've done it. So have you gotten rid of the underlying causes of that problem?
Right.
And so the key there is demonstrating that progress. So that can be how the individual feels, how other downstream effects that come from that cause are being dealt with. That can be through appropriate lab work. It can be other measures. For instance, osteoporosis is the are the bones getting stronger? Mm-hmm. You don't want to wait till someone has a fracture to say, or have a fall to say, well, my treatments worked because they didn't break their hip, or no, it didn't work because they broke their hip. You don't want that. So you can do DEXA scan. There's also a urine test to see about bone turnover, and you can use that as a marker for your therapy. She doesn't feel any of that. She doesn't know if her bones are being
Right.
healing or not, but you can measure that. So it's knowing the physiology, the biochemistry of the person, what's going on, using appropriate testing to see if they are responding. And then ultimately, if they have symptoms that have risen to the level of awareness, you can follow those symptoms as well.
Okay. So how much, or maybe since you've been in both sides of that, medical model and functional medicine, I believe in a lot of self-advocacy, being a participant in my own healthcare. Other folks, maybe not so much. We're really busy people. Again, we're microwaving our minute rice. We just we can't live life fast enough. There's a lot of stuff to do.
Right.
I got lots of responsibility. Right. Just give me the pills. Just give me the pills.
Right.
And right. I'll take them. I'll probably be compliant, and most likely this is going to go away.
Right.
Okay. Last year, I've this happened. I recognized the song. Just give me what you gave me last year. We'll be fine. A lot of that is how we do medicine.
Right.
And so, it seems like functional medicine, the level of participation has to be like there's a level of has to be that's incorporated into functional medicine.
Right. Right.
And our folks who, and this is probably subjective, but for folks who have been conditioned, I'm just going to do what my doctor tells me.
Right.
Who never had to think about, I have to do something.
Well, behind that is the belief that the doctor's going to fix them.
Yes.
Not the recognition that their body is going to heal or potentially could heal. And so
that's that believability that I talk about.
That's an extremely important part of it. Mm-hmm. And it's not a placebo effect. That's not what we're talking about. Powerful as a placebo effect is, but that's not what we're talking about. But it's people can come to me and I typically tell them, I'm not going to fix you. This is the medical model says, I'm going to fix you. You take this pill, you listen to me, your symptoms are going to go away and you're going to be fixed. And that's behind what they're saying. I'm too busy. I don't want to deal with this. I want the pill to fix me. Okay. If that's their thinking, I can't help them because they need to understand that it's their body that is going to get better or not. Mm-hmm. And I'm going to teach you. I'm going to walk alongside you in the journey. I'm going to be with you to address your questions. I'm going to give you the help that you need, this supplement, this nutritional piece, the advice to get more sleep, help you understand what you're doing to hurt yourself so that you can take the steps necessary to stop hurting yourself in many ways.
That sounds radically different.
It's not really radically different. Well, no, you're right. It is completely different. But it's getting back to ways that make sense.
It's if I don't have time in my day right now,
right? How
am I going to find time to do that?
Well, interesting. It's just like what we said in surgery. You're rushing through an operation, and my mentors would say, if you don't have time to do it right the first time, how are you going to have time to fix it the second time?
Yeah, and that is the paradigm shift.
Yeah,
I think those I would see those as barriers into that paradigm shift buy-in.
Yeah,
right.
And to be fair and to be helpful to people, part of that flows out of the way the traditional model is constructed. It's based on a diagnosis or something that comes to immediate attention, and so then you react. So it's something now that is in front of us that we can see, whereas what I want to get across to folks is this has started 10, 20, 30 years before when you
Right.
couldn't see it. But if you want to use the metaphor of tending to the soil of your health, that's where we have to get back to. We're establishing a healthy condition in your body so that you don't have this slow growing problem that now manifests as high blood pressure, which has damaged my kidneys, or diabetes. And so I have tingling in the bottom of my feet and it hurts because I have dead nerves. We don't want to wait till that, which is what we're conditioned to think. I'm okay until I have a diagnosis.
That's how it has been programmed into us.
Right.
Like
Right.
healthy, not healthy.
Right.
Well, sick.
Right.
Sick, well.
Right.
And so do you think we've talked about the patient side of that.
Mm-hmm.
Let's talk about the practitioner side of that. Because I would imagine the practitioner would have to radically change as well as the patient and adjust all kinds of expectations on how this is going to go, how this is going to play out.
Right.
So what has been your experience in speaking of functional medicine practitioners, colleagues, as well as maybe the old cast of practitioners that you used to work with?
Yeah. Yeah. Well, I'm kind of in that old cast myself. So I've been at this for a long time. And I'll speak from my experience first. It has been very difficult to, first of all, to see how I've been trained, to have that come to recognition and say, wait a minute, no, I need to think about this differently. So I recognize that I've been socialized in medicine, for instance. They said that in medical school, you learn a new vocabulary of maybe 25,000 words. I can't remember a time when I didn't remember or know these medical terms that I think nothing of using. So the point is socialization. So I have to learn or unlearn how to approach these problems. I want to try and come up with something that's going to fix it. And the first key there, and it's patience with the process. And so that knowing that, I can then help lead my patients as well. So that's the first part. It's been very difficult to trust the validity of this. So for instance, what I had to do, I would hear or learn these things and I'm thinking, no, that can't possibly be. And then I'd go to the medical literature and lo and behold, there it is. Well studied, evidence-based, excellent results. And I had not been taught that because we have blinders on in the way that we practice. So unlearning all of that. And there's a process to that. Even in some ways, maybe grieving a little bit. Certainly,
I would think.
yeah, you're out of your comfort zones. Like, how do I do this? Disorientation. It has its challenges. And that then gets to the second part of your question, my colleagues. And oftentimes people are threatened. They don't want to deal with it. I remember talking to one practitioner, primary care, I believe, or internal medicine. He clearly needed help. He was struggling with obesity and ill effects of that. I believe diabetes, if I recall. He just wasn't healthy. But he didn't want to hear that there's another way to do this, and it's not pills, procedures, or potions that you need to rely on. And it's a challenge. Like I said, that socialization piece, it's a challenge when something comes up against that. people often feel threatened.
Yeah. By nature, change is difficult. This is
Absolutely.
radical change.
It is.
And I would anticipate it not being swift. But I do think both sides of that equation have to kind of, and I'll speak for myself. One of the things that I measure my change by is how is my energy going to be affected by it? Like how much energy, how much effort, how much of a change that's going to be. For example, when I worked at the hospital with cancer patients, I was on Zoom mode all the time. You were up and down different departments, talking to clients. You're always on. When I went into private practice, I was warned. Chuck, you're going to go through this like adrenaline drop, like you're just ill prepared for.
Right.
And I got it. It's cool.
okay.
Yeah, it's welcome, all that. No, it was like a catastrophic change. And it took at least a year and a half to really have that energy. And that I'm talking about habits, planning, predicting what you're going to do, getting your body adjusted to that change.
Right.
So all that plays into how we do change. It's just not behavioral change. And something like this, since it's a core issue, our health, I would anticipate there be, that sounds good, but this is how we do it.
Right.
And this is what we know. This is how we're doing it. Just play the gig. Just do it. And make it easy on yourself. Right. I mean, all these all these things, and they play well. I mean, on some days they just may sound attractive. However, you now know what you know,
Right.
and that's so hard to go against.
Right.
And so that's why I hope that process does gain traction, more traction. Awesome. Thanks for answering that question.
Yeah. Yeah. Thanks for bringing it up. They were good questions.
All righty.
Something we need to be thinking about.
Absolutely.
Yeah. Thanks, Chuck.